feel like if I hadn't done what I did, that I probably would not even be in this situation right now. Just knowing that, it makes me feel bad, you know?
I worked 14 years on Wall Street. My last position, I was a vice president at one of the major financial firms. Then September 11th happened, which I witnessed firsthand. And my father's death in 2000 just kind of made me just re-examine what I wanted to do with the rest of my life. I figured if I'm gonna make a change, now's the time to do it. Took the MCAT, applied to medical schools, and I got accepted at Stony Brook.
I was convicted of possession with intent, and it became a felony. My daughter, she just, I think she saved me. I was like, wow, I'm having a baby, you know? So it was just like life-altering. Being that I have this conviction now on my record, it kind of hinders me from doing a lot of things. I was trying to get into New York City housing, so no, they won't let me in because of that.
You know, there's a lot of stigma attached to, you know, patients who are on like Medicaid or on welfare, but you know, their parents, they want the best for their children, just like kids of CEOs, you know, they want the same exact things.
So what I'm trying to do now is really like focus on doing what I can to make sure that my mistakes don't affect my children.
I love what I do. I just really enjoy what I do. Not that I'd enjoy working in investment banking, but I love seeing my patients. I love that they know that, okay, at least there's one person who's really looking out for their best interest and who cares. Let's look in this one. Dealing with this homeless population is tough. They're dealing with so many extraneous things going on in their life. It's like, I gotta figure out where I'm gonna live. I gotta figure out how I'm gonna feed my children. And you as a physician try to make it easy for them to come. You'll hear, you know, like, you know, I went to this clinic and it wasn't that great, or I felt like I wasn't taken care of properly, or maybe I felt rushed, but you don't get that here. Patients have been really happy, and that's how I met, you know, Miss Ebony. What was nice is that, you know, we had the mobile van come to her right at her doorstep. She was able to get services for her children, and then, you know, the clinic is right here within walking distance.
I had to go to this doctor and that doctor, and it's very hard. People just don't understand. They think that, you know, they see these people with strollers on the train and they just like, ugh, why they just don't get a car. But it's not easy to get a car, you know?
We were able to do vaccines on the van and, you know, do all the developmental screening. Her young daughter has autism. So, you know, we were able to get her involved in our behavioral department. So she, you know, she was being seen on the van. She did all her follow-ups. And then when we were open, she was able to just continue services right here. And she stayed with us. She stayed with us, yeah. Ebony's she's special. She's a single mom. She's taking care of her two beautiful kids, and she does such an excellent job with them. We immediately bonded.
You want to try to give your children the best. Everybody does. And I feel like Brightpoint is the best.
Brightpoint Health drives dramatic improvements in the health of New Yorkers. And we're trying as hard as we can to put the patient at the center. We're trying to address them by saying what really matters to you today when they come in for a service, rather than what's the matter with you. And it totally changes the power dynamic. It totally changes how people feel that we're going to address their needs. Very vulnerable populations are who we've been committed to. We started as a federally qualified health center that serves the homeless population. So we had to develop our services around those needs of that community. As a nonprofit organization, we definitely had struggles and barriers with how we were billing and how we were collecting and all the back office issues that enable an organization to survive. So when we had the ability to have a connection to NetSuite with an organization that gave us a break on the cost of this consulting and ability to help us change our systems, it was a tremendous attribute for the organizations. This helped to transform our operations in a dramatic way.
So our old system was very antiquated and it was DOS-based. In order for us to close the books, we were looking at easy 90 days after month end. Now we're doing it in 15 business days. It's not just about, running a P&L at the end of the month. It's about so much more and what can your system do for you. And NetSuite's able to take all our data and not just provide me a financial at the end of the month, but really give me access to so much more data that I can make so many better decisions on. If it wasn't for the netsuite.org grant donation, we would have never been able to choose NetSuite as a platform. Every quarter, we're able to apply for a Suite volunteer based on a project need that we have. And Suite volunteers can come in and help us not only ensure that we're using our system to the full capabilities, but also trying to take it another step further. It's really important to invest the right resources into the administrative side and not-for-profit, because that administration is what's going to be able to drive the clinics and drive all the other businesses that we do in order to ensure that they can fulfill their mission.
Patients love it here because I think they feel like they're valued. And I think that's what Brightpoint does.
It's been like a roller coaster, like emotionally, physically. Just to be able to come here, see Dr. Nelson, it lightens my load a lot. It helps to know that people actually care still, you know what I'm saying? Like, they really care.